as a child and teenager, I struggled with self-harm, like other forms of self-harm when I was really little, but then from like 11 to, I don't know, 17-ish, cutting myself. And maybe because those are forms of like very literal self-harm, a lot of people just really don't get it. And it's easy for me to understand why people don't get it if it's not something that they have ever been kind of like compelled to do. And I also can really easily understand why it seems like you just want to feel bad if you're literally causing yourself pain, right? He ever, like, I don't think directly said anything like that to me, but I just kind of, I don't know, somehow sensed that, like, most people don't get this and most people look at it as like, you are really crazy kind of a thing to do. And I didn't understand my own coping. Like, I didn't know why I was doing this. I did know that it didn't make me feel worse. I knew, at least not, it wasn't that simple. I knew it when I first did it, it was because it made me feel better. Then there would be I did feel shame over it. So there was a component of it did also make me feel bad. But there was always some level of relief initially, and that's why I was doing it. I wasn't doing it to make myself feel shame. But that was a hard thing to understand or to certainly try to explain to anybody. Like, how can it cause you relief to feel pain? I now have a better insight into it, but it was a tool for regulating my dissociation for me. I was living in a home that was constantly triggering my trauma and was kind of actively giving me new trauma, right? Mostly living with my stepdad, who was saying sexual comments about my body all the time. But also just lots of yelling, lots of emotional immaturity, not being given the benefit of the doubt, just a lot of emotional neglect and not emotional support. And so that was completely overwhelming my nervous system. And so using self-harm was a way that I could kind of encourage my body to dissociate. And so that's where the relief came from. It came from being able to take my thoughts and feelings and my body sensations out of what I was living in. There was a disconnect between me and that emotional pain. And so it's a way I was protecting myself from emotional pain. I did this long enough and frequently enough that at some point it kind of got to be a type of situation where it's like when all that you have is a hammer, everything starts to look like a nail, if that makes sense. So towards the end, maybe like 14 to 15, I also was able to use it to come out of dissociation, because there were times where I would stay so heavily dissociated for so long that something kind of good would happen. Something that I would consciously think like, this birthday party I'm at, or this, sleepover I'm going to with my friends, like, this would have felt good before, and I don't feel anything right now. I just feel like gray. It was like I was totally numb, even to the good things. That's the downside of dissociating too much, is you stop being able to feel the good feelings too. And so there became a point where I felt like self-harm could also pull me out of dissociation sometimes. So it became a regulating tool on both sides. Of course, I am not at all suggesting this was a good idea or a healthy thing to do. It obviously wasn't. But it wasn't just me trying to ruin my own life or trying to do bad things or harmful things to myself. And also, for at least the last couple of years, I really wanted to stop, and I could not figure out as a 15-ish year old why I couldn't make myself stop despite really wanting to, and also with knowing, like, I started to see the cycle between there's this relief, then there's this shame, and then there's this kind of like ruminating over the shame. And sometimes that shame would make me more inclined to want to do it again because I felt so bad. I knew it was a cycle, at least as I was a little bit older. I have stretches of time where, I would stop for a few days or sometimes even a couple of weeks. But it would take like everything I had, and then I would slip up once, and then I would feel so terrible because I felt like it was worse to have done it once after like a week or whatever of avoiding it. So that brought in this really big shame, and I didn't understand all of the details of this. But from my perspective now, the real core problem was my living environment. I started therapy, I think, at 13, and we didn't talk about this that much on an ongoing basis because we realized that talking about it, like whether I had done good with not doing it or not, was actually making me feel shame in the therapy space. And he didn't want to be adding any shame to my situation, so we didn't talk about it that much, which I do think was the right thing to do because it was so shame-inducing for me. However, it also meant that because we weren't talking about it, he couldn't really give me any insight into what might be going on with me related to this coping method, so it kind of had its pros and cons. But still, when I was living at my mom and stepdad's house, my weekly therapy sessions were just venting about current events. And then once I was 15 and I moved out, it's not like the self-harm immediately stopped by any means, but I noticed a shift in my therapy sessions in that I started to be able to talk about like earlier childhood stuff, to talk about like core wounds. It wasn't just that every single week was so hard that all I could like access in a given therapy session was what feels so urgent right now. Moving into a home that was a little healthier for me, more than a little healthier for me, just gave me this like breathing room. And then I wasn't constantly so beat down just from day-to-day life that I really didn't need that like release valve that I was getting from cutting all the time. And it wasn't an immediate stop. I still would occasionally have bad days, mostly when I would experience some sort of trauma trigger and I would, go back to it. But it was like I clearly started on the path to stopping once I got out of that house. And from there, it was so much easier to work towards quitting because I always had wanted to quit. It was just that the intensity with which I needed it was so big that I couldn't access anything else.